6-month-old boxer Cross has been rushed into Bondi Clinic by his owner Jeff.
What's his name?
His name's Buddy.
Buddy's struggling to breathe and his face is severely swollen.
His face just went woomph like that, all in a matter of 2 or 3 minutes. Because that's a bit swollen, but you can see the colour difference in the eye, obviously. And his lip is like...
That's huge, isn't it?
It's massive on both sides. I feel that.
Yeah.
It's all right, mate.
He's distressed, he's having big trouble getting his air in. This looks like the classical signs of an allergic reaction and we need to stabilise him and do it very quickly.
And my mother-in-law found a wasp, a tiny little black wasp with a brown body on the kitchen floor that was dead.
Yeah. Buddy, you got to be good for us, okay?
It's all right, mate. I'm here, mate. It's okay. It's okay. It's all right. I'm here.
Just calm down.
Buddy's gone into what we call anaphylactic shock. Now, if that reaction is severe enough, his airways will constrict. If that happens, he won't be able to breathe at all.
What Buddy needs urgently is a cortisone-based drug and an antihistamine to settle his breathing and stop the allergic reaction.
Oh, you still are. Far out.
Hopefully the drugs will do the job in time.
If it doesn't work out, it doesn't work out. If we can just give it a go, it'd be great.
Just put it in, mate, because he won't stay still.
No, we can't go too quickly.
Oh, righto.
Alright. Great, buddy. Thank you, mate. Just keep calm there. Okay, we're almost done. Sounds like he's starting to take deeper breaths here, which is good. His heart rate slowed down a little bit, which implies he's a bit more relaxed.
Yeah.
20 minutes later, and Buddy's condition is slowly improving.
Give the missus a call and give her an update.
Jeff's partner Rebecca is waiting anxiously at home with their 1-week-old baby girl, Amelia.
You know how kids have shots to protect themselves? Can you be given something so that if it happens again, that doesn't happen?
It's like, I guess it's like a kid with either a peanut allergy or a bee allergy. All you can really do is just be on hand, watch him where you can, but the moment you see any sort of swelling, just obviously give me a call and we can give him the medication.
Your number on the fridge.
Well, I'm sure.
He's fine, though.
He's looking at the phone wondering why he can hear Mum but can't see us, so...
Oh, little home with his little girl.
But don't worry, he looks like he's going to be okay.
Thank you very, very, very much. I'm very relieved.
Alright, no worries at all.
Bye.
Thanks, bye.
See ya.
No worries.
Well, hopefully he's smart enough not to go near it next time.
It just shows you can't wait around till the next day to see if these things are going to sort themselves out. Jeff acted straight away. As a result, Buddy's alive and one very lucky dog. Look, if you're worried about him tonight, give me a call. Oh, he'll be fine.
Sweet ass.
Okay.
No worries.
You sleep well, alright?
Thanks a lot, Chris.
No worries, I'll see you later.
This is a little bugger that caused so much drama to our little boy, our dog.
It's good news for Buddy the boxer, who's made a complete recovery from his allergic reaction to a wasp.
So we didn't think we'd make it. Just thought we'd been given the most precious gift in the world, and at the same time we were going to lose our little boy, so it was horrible. Thank God for Chris.
That's right, yeah.
Without him, we wouldn't have a dog.
What's happening?
Well, this morning at about 2:30, Patch started coughing and choking, and then it just got too severe that we thought, well, we've got to do something. I thought I was going to lose her.
And she looks like she's really wiped out, doesn't she? Hey, sweetheart.
She's definitely a mum's dog, and she barks if I'm not there.
She's been barking a lot?
Yeah,
okay.
Yeah,
so she's been fed bones recently?
No.
And no chews or rawhide treats or anything that could have got stuck in there?
No.
Okay, we'll pop her up on the table.
Okay.
Okay. Hey, Patchy girl, let's have a look at your breathing, sweetheart. I'm looking at Patchy girl now and she's very relaxed, but I can't ignore what Leslie has described. An episode where Patchy girl was struggling to breathe, had a severe episode of coughing. Something is definitely going on with this dog. And what you're describing to me sounds like she may have a problem with her airways, so a problem potentially with her windpipe. The only way that I can work out what's going on is to take an X-ray of her neck and of her chest. Leslie's love for Patchy girl is so strong. It's like she's her child. I'm really feeling the pressure on this one. You come with me.
Very precious package.
I know. All right. I won't be too much longer.
Okay, thank you.
At SASH, Lisa is x-raying Patchy Girl to try and find out the cause of the little dog's severe breathing problems.
All right, let's have a look. She's got a collapsing trachea. Yeah, her windpipe, you can see, is tiny. When a windpipe collapses, it causes a dog to cough. It also prevents them from cooling down properly and can cause a lot of inflammation in their airways. In the very worst of cases, they're not going to be able to breathe properly, and that can be fatal. Hey, sweetheart, let's get you set up in a bed, okay? A collapsing windpipe normally shows up in middle age to older dogs, and Patchy Girl is a relatively young dog. If she's this bad now, I doubt she'll live a long life. You're okay, darling.
Lisa now has the tough task of breaking the news to Patchy Girl's distraught owner, Leslie.
So, Patchy Girl's x-rays show me that she does have a condition called a collapsing trachea or a collapsing windpipe. Okay, so when Patchy Girl breathes, her windpipe is floppy and it snaps shut and it's not letting much air in. So what you were describing was a very acute episode of it that was probably brought on by maybe barking too much, and unfortunately because it's a degenerative condition, it will get worse over time. There are only two real options for Patchy Girl. Manage her medically, which is not guaranteed, or place a stent under anaesthetic that is going to keep her windpipe open and hopefully prevent this from ever happening again. So you're happy to go ahead with the procedure?
Yes.
Yeah?
Yes.
Let's go through and see her.
Okay. She deserves this surgery because of what she's given to us in our lives. To save her life, it's the most important thing. Hello. Oh, come on. Oh, you have been through so much today. Hey, you got a bit more to go. Okay. It's nothing worse to see a dog not being able to breathe. It's horrible. I know she's in good hands, but seeing her little face there it was difficult. Yeah, very difficult to say goodbye.
You can call us anytime.
All right.
Okay.
Oh,
don't look back. Hey, it's your big day. I know, honey. All right. Yeah, we're going to try and fix that windpipe of yours.
At SASH, Patchy Girl is being anaesthetised so the team can work out the best way to repair her collapsed windpipe.
Okay, good. How are you?
How's the patient?
She's ready for you.
Good, good.
Medicine vet Dr. Justin Wimpole needs to insert a camera into the 7-year-old's trachea to see if a stent can be inserted.
All right, let's do it.
This will hopefully open up Patchy Girl's chronically narrow airway and help the little dog to breathe.
A stent is a device that will keep Patchy Girl's windpipe open. Placing a stent is a very, very risky procedure.
So we're just going having a look down her trachea. So I'd really like her to give a nice strong cough so we can see how much this trachea does collapse under pressure.
The image clearly reveals Patchy Girl's narrowed and inflamed airway.
You see the trachea is narrowed. It's just not collapsing as badly as I would expect, considering how much difficulty breathing she was having.
Having a stent put in is a big thing to go through if we're not seeing any evidence of it now.
Yeah, so there is some collapse, it's just not that severe.
It's now a race against time to work out what's going on with the little Shih Tzu cross.
Leslie is really nervous about this. It's not an easy thing to go through with your beloved dog, so I just hope that we have some good news for her at the end of the day.
What's up, Justin? Hey, Andrew, how are you going? So we've got this little dog, Patchy Girl, who had severe respiratory distress, and she's got some tracheal collapse, but it's not, it's there, but it's not as severe as her symptoms suggest. So I could see her larynx working, but I'd just like you to
At SASH, Lisa and Justin have now called in specialist surgeon Dr. Andrew Marchevsky to look at Patchy Girl's voice box.
The actual larynx is working well and the voice box is not collapsed and nice and strong, but yeah, those factors I think might be causing a bit of a problem.
Andrew is examining Patchy Girl's voice box and has found that the lining of her voice box has popped out, which is definitely contributing to her coughing and breathing problems.
So we could probably do something about that now if you want.
Yeah, sounds good.
Yeah.
Okay.
Okay.
I'll go and get some tools.
Andrew is going to perform surgery on Patchy Girl's voice box to trim away the lining that has popped out, which will hopefully help her breathe better.
And I need you to hold her tongue right there. So what I'm going to do is I've got a very fine pair of scissors and I'm just going to cut away that tissue to get rid of the obstruction. And just drop her head a little bit, please. And point it that way a bit, please. Thanks. These pieces of tissue that I'm removing are not very big, but her airway is actually not very big either, so it doesn't take much to cause a big problem. So that's just one part of the lining that's popped out, so we've just cut that out of the way, and then we'll go and do the other side as well. All right, we can put the tube back now. That's definitely the procedure we needed to do with her. Her collapse just in her windpipe just wasn't bad enough for us to justify putting a stent in. But with that voice box being obstructed by those little flaps of the lining of the voice box, us getting them out of there will help her.
All right, little Patchy Girl. Hey, well, hopefully you'll be all better for your mum. Pie. You're a good girl.
At SASH, it's been just 24 hours since Patchy Girl had surgery on her voice box.
You look so good, hey? Let's take a look at you.
The little Shih Tzu cross has made an amazing recovery.
I think it's home time for you. I do.
Devoted owner Leslie is desperate to see her precious girl.
It's incredible. I just can't wait to see her.
Let's go see Mum. Huh? Let's go.
I cried as soon as I got home knowing she wasn't there because I've never, ever, ever been away from Patchy Girl and she's never been away from me.
Look who's there.
Hello, 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 Patchy Girl. Oh, yes.
When Patchy Girl sees Leslie, she just nestles into her arms. She knows she's safe with Leslie and she is so happy to be finally going home.
You look just so much better. And you know that everyone's looked after you, haven't they?
It's a pleasure, Patchy.
Absolutely thrilled with the outcome. Really, really thrilled. It's a good girl. Oh, that's lovely.
Sit, Danny. Sit. Oh, I love the lambs. They're absolutely adorable and Danny's just gorgeous. Good boy.
He came in here when he was about 8 weeks old. He was bitten by a tick and almost died.
Every day I was sort of nursing him by his bedside while he was on the ventilator, and then we got him off and it was great when we sent him home. I just didn't expect to have him back so soon. Oh, you big boy.
He got something stuck in his throat. He picks up all sort of rubbish. He's trying to, you know, regurgitate it out and coon and, you know, yeah. Breathing is healthy, so we brought him in.
All right, I'll take him out the back, have a look in there, see what's there. Okay. Danny's got something stuck in his mouth, apparently, so I'll have a look inside and see what's there.
He had a feel and he said it's something...
a long plastic.
He's breathing quite heavily. He's sort of making a bit of a huffy noise, but I really couldn't feel anything in there. So. If Mr. Lamb hadn't felt something stuck in Danny's throat, then I would be absolutely certain that he's got a paralysis tick. What's going on, mister? I think I'm just feeling his larynx there. Oh, sweetheart. I am worried about this noise he's making. I'm worried that he might have something almost partially obstructing his larynx. Come on. He's coughing, but it's not the normal cough that a dog does, like when they've got kennel cough. So we'll take an X-ray and just have a look if we can see anything abnormal there. Good boy. Danny's just a baby, and it's cruel that he has to go through something like this again. I have to take this just for their peace of mind, because they said they saw something in his mouth. Oh, it looks pretty good. It all looks pretty normal. I can't see anything stuck there. It's air moving all the way down, which is good. So, unfortunately for Danny, I think he's probably got a tick. And the fact that he lives in a tick area and he's had a tick before, it just all fits in. What a tick does is it paralyses parts of the body. So they have a toxin that they release into the bloodstream when they latch on, and that causes paralysis. And it can affect anything from the back legs to the upper airways to the breathing muscles. Potentially, one bite from a tick on the susceptible dog can cause death. Danny has deteriorated rapidly since he arrived. I mean, he's becoming more wobbly. He's lost his ability to swallow. Look at that, that's so different now. Looks like a crater. It does. And the fact that it's on his head and he's got these signs of gagging, it would all fit in. Hey, sweetie. All right. So I can't find anything in his mouth. We stuck our hand quite far down, there was nothing there. And so I took an x-ray of his larynx and it all looks normal. So you won't believe what I'm going to tell you, but I think that he's probably got a tick again.
Again?
When I look at him now and he walks, he maybe is a little bit wobbly. He didn't want to go up the stairs before. No. And he's doing sort of this noise, and dogs that have tick paralysis can do that. So I think it's happened again. I just can't believe it, because the lambs went through absolute hell last time. We didn't even know if he was going to make it off the ventilator, and everybody just became so attached to him. He's just so gorgeous. And I'm worried that this is going to be a case of deja vu.
Did you search him?
I have had a look, but he's got quite a thick coat of hair now, so we're going to have to clip him and have a better look.
Okay. Oh, so ugly.
And then the next step would be to give him more of the anti-serum again. I think if we give him the anti-serum, then he's hopefully not going to get much worse than he is. So we're going to run the anti-serum in before we even look for more ticks, because I don't want him to deteriorate any more than he already has.
There we go.
The sedation has really kicked in quite nicely. We found anything? There's one. This is a tiny tick. I mean, they can get to 4 times the size of this easily, but such a small thing can be deadly to a dog. Danny has had the worst possible experience from a tick. Last time, we didn't even know if he'd ever go home again, so his family would be shattered if that had to happen again. Oh, Danny boy. Hey, who's the sleepy one? At the moment, Danny boy is stable. We found one very tiny dead tick, and then we found a crater on his cheek where we think a tick was once feeding. We haven't found anything else. So we're going to give him a tick dip, and we'll keep on checking him throughout the night. It's a good bath. I just hope we've got it early enough that he doesn't have to go on a ventilator, because that would just be awful. Are you cold? You're talking? I'm just so worried about him. I'll see you tomorrow. You sleep well, Mr. Moo. Why don't you lie down? Want to lie down? Lie down, hon. No, I don't want to lie down. I really love Danny. He's one of my special patients. Last time he came here really severely affected, and he went home and it was great. We were all celebrating, and then he comes back regularly for cuddles, but we're not the only ones who love Danny. I think the ticks love him too. He must have very sweet blood. You're a good boy. You are. Hey, keep your bucket, keep your bucket. Let's see you walk. Oh, you're looking good. You're looking good, sweetheart. Come on. Come here. That's a good boy. Can you sit? Sit. Danny, sit. Good boy. All we have to do now for Danny is wait. So waiting for his body to metabolize any remaining toxin and for him to get his swallow reflex back. Once he can swallow normally, we can feed him, and if he's eating well and not regurgitating, then we can send him home. Let's check your gag. Not that great, buddy. And let's see if you can swallow. Stay there. Open up. Still not great. Tick paralysis can affect different dogs in different ways. His main problem was that he couldn't swallow. And if you can't swallow, then that means your food sort of just sits at the back of the throat, and there's the risk that you can inhale it, and that can cause a big infection in the lungs. Danny has had pneumonia before when he had tick paralysis, and it took him over 6 weeks to recover from that. That's great. Danny, you thirsty? A little drink, just a little drink. Says, no, I want food. Danny hasn't eaten anything or had anything to drink in over 48 hours, so the poor little guy must be starving, but I'm going to be cautious about it. He says, please, I'm really hungry. Oh, I'm starving. Look what I got. Look, Danny. Hang on. Get you to hold that. One ball, one at a time. Wait. No. Oh, you're starving. Okay, we've got to see if you can swallow it. That's it. You keep that down and you can go home.
Miss him very much. And I came in on Sunday, but he was very upset when I left.
Yes, you're going home. Wait.
He is not going to have any more hair. I'll shave it every week.
No, you're not.
Who's going home?
Yeah, short hair Labrador. Now, I have to put a sign up on his head when we go walking that he's a golden retriever. All right, okay, yes, I miss you too.
Mrs. Lamb is absolutely besotted with Danny. Who wouldn't be? He's just the most gorgeous dog. He's so easygoing, he's so lovable, he's just adorable. He looks a bit like a Labrador, don't you think?
Don't ever say that.
Don't say that. No, we're just teasing. You're a golden retriever, aren't you? Hopefully he'll be back for a visit for cuddles. No more ticks, and they're under strict instructions to check him every day.
Bye.
Bruno, a 7-month-old Boston Terrier, has just arrived at Bondi's referral hospital SASH in a critical condition.
And he's actually been run over by his mother. The poor little guy's got a back leg which is snapped in half, and he's also got a tear in his lung which is leaking. So the back leg is the least of his worries. We really need to just get that air out of his chest because that's what's going to kill him.
Before a chest drain is inserted, Bruno's owner Jackie is allowed into the emergency room for a quick visit.
Hey, little man. Yes, your mum.
It's all right, Mum. It's all right. I was driving up the driveway, and when Bruno saw the car, he raced over and I didn't see him at all. Yeah. Well, I went into panic mode to start with because we didn't think he was going to make it, and just broke down, basically. Yeah. He's a gorgeous dog. He's got a really sweet little nature.
You know, it happens a lot. It's awful because the owners feel so guilty, and I really feel for them. It's terrible.
Andrew must now plunge a trocar into Bruno.
Have you?
The air that's trapped between Bruno's lung and chest wall has to be sucked out urgently before the puppy's system crashes.
You've got to get it in the right place, because if you're wrong, you can hit the lung, you can hit the heart, and that would just be disastrous. You're actually making a hole in the chest wall.
Okay.
So it's a real race to seal that off and suck the air back out before the animal crashes.
It's dropping again.
Bruno's blood oxygen levels suddenly start dropping. If they plummet too far, the puppy could go into cardiac arrest.
Come on, buddy. Ideally, his blood oxygen level should be above 95%, and now it's dropping to below 85. We just need to stabilise him quickly.
How can you go from 96 to 85 in 2 seconds?
But only a few minutes later, the tension starts to ease as Bruno's blood oxygen levels begin to climb.
94.
That's a good number.
Bruno's now being hooked up to a pump that will keep sucking the air out of his chest overnight.
There you go, little man. Says, what's going on?
He's 8 kilograms. He's taken on a car that weighs practically a tonne. I mean, he's alive, but he's not out of the woods yet.
At SASH, Bruno, who was run over by his owner, has managed to survive a life-threatening torn lung. X-rays have confirmed it's completely healed. Now the emergency team can start operating on his badly fractured back leg.
Bruno's battle's not over yet. Going into surgery is going to be the biggest test on his lungs. When he's under anaesthetic, that could re-rupture the torn lung, and then we could go straight back to square one.
A specially contoured plate is moulded to the bone and attached with a series of screws to stabilise the leg.
God almighty!
It's a difficult operation to get the leg aligned perfectly, but after several attempts, Andrew is finally happy.
That's come together really nicely. It's worth the struggle. His future's looking pretty good, yeah. I think Jackie would be very happy with him in a couple of weeks' time, and he'll be running around the place again. Says, I'm exhausted, Mum, I need to sleep.
You're a good boy, Bruno. You're a good boy. Hey, that's for a kiss. Thank you. Yes, that's a good boy.
Lucky survivor Bruno is ready to go home. It's all clear for his lungs, and his leg should be fully healed in 8 weeks.
Hopefully he'll have learnt his lesson, he'll steer clear of cars from now on, but they do tend to forget.
Yes, she is. Oh, it's exciting, isn't it?
Hello, beautiful. He's shaking like a leaf.
He
Hello,
is.
mate.
Well, he knows you were behind the wheel of the car that got him.
Did you just say that? Hello, gorgeous boy.
He's got to learn to run a bit faster, you've got to learn to drive a bit slower. He's such a cute boy.
Oh, it's really good. So pleased to have him coming back home. Yeah, it's a relief. I can stop worrying about him now. Little tough nut.
There's a bit of swelling there.
2-year-old Digger has been rushed into the Bondi Referral Hospital SASH after developing a swollen throat and struggling to breathe.
Have you eaten something, mister, that you haven't told your mum?
It's really serious when a dog comes in with breathing problems. We only have a few minutes to work out what's wrong, to stop him from obstructing. They can even die really quickly.
Good boy, Mr. Digger.
Digger's devoted owners, Ingrid and Ian, are desperate for answers.
It's a mystery. It really is a mystery as to why he's the way he is at the moment. We love him to death and we just don't know what it is, and we're hoping these guys can help him.
Right, can we take an oxygen reading on him as well? I've had a bit of a look down Digger's mouth and I can't see anything stuck in his throat. I'm going to take him through and have a look with the ultrasound and see if there's anything abnormal there. So he's got this swelling under here, and we'll just have a look to see if there's any fluid inside it.
Bit of a mystery, Mr. Digger.
That area there looks a bit abnormal.
So you think there's something solid there, or is it fluid, or?
It's not a pocket of fluid, but it could be the start of an infection. Digger's life is in danger. We really need to find out what's happening with him, so I'm going to send him through to our specialists to do a CT scan, and hopefully it'll be able to answer the question as to why he's having trouble breathing. Hey. We'll make you feel a bit better, hey buddy? Good boy.
At SASH, 2-year-old Digger has a swollen throat and is struggling to breathe.
If something is stuck in Digger's throat, we need to find out what it is so it doesn't become fatal. I can't work out what it is at the moment, so the next step is to talk to Ingrid and Ian and see if they can give me any clues. Has he had any previous medical histories?
About a year ago, he noticed this huge lump and said, hey, I think you better take him to the vet. And they put a slit in his throat and put a cone on his head, and we bathed that for a couple of weeks. He was on anti-inflammatories and antibiotics, and when that all finished, the wound started to close over and
it healed up?
Yeah.
If it is related to a year ago, there could be this, any fragment of bone, grass seed or stick just under the skin there, and it can disappear with antibiotics and then flare up again. And until it's removed, you could get this problem happening over and over. If there's something there, we want to find it. CT scan's a good way to find out exactly what it is and whether we need to do surgery on it or not. Okay, well, would you like to come through and see where Digger will be tonight?
Yes, please.
Okay.
Yep, definitely.
That'd be great.
Yep. Thank you. I don't want him to have to go through surgery if he doesn't have to. But by the same token, we're not going to muck around. If he needs it, they have to do it, get it done.
Hello, baby.
It's Mum and Dad.
Hello, Papa. Hello, baby.
Oh, he's happy to see you.
Oh, baby. You'll be right. Oh, I love you. You're going to be okay.
This must be really tough for Ingrid and Ian, saying goodbye to their little boy Digger. He's such a part of their family. I can't give them any answers as to why he's having problems breathing tonight. Hopefully the CT scan will let us know, but there's just no guarantees.
We're looking for little fragments of bone or stick or something like that. It is a little bit like looking for a needle in a haystack.
Later that day, Dr. Steve Fernside is starting the CT scan and the search for clues about Digger's condition.
We're really not sure of the cause of the swelling there at the moment. We're looking for things like bits of twig or bits of stick or a bit of bone that he's chewed, swallowed, and it's gone through the lining at the back of his throat and got caught in the tissues. The interesting thing with Digger is that he had a history of having an abscess or something in his neck about several months ago. So is that tied into the problem now, or is this a completely new problem? It's tantalising to make the connection because it was in a similar area. So we need to try and ascertain whether there's something still there at focus that could be creating an infection recurrently in the back of his throat. This is Digger lying on his back, and this is the back of his skull. And as we screen through it, this is the area of his larynx, or his voice box, if you like, around the base of his throat. At this stage, I can't see anything terribly sinister there, which is good. I'm trying to put the piece of this fairly complicated puzzle together, and medicine's like that. It is often a puzzle that you've got to put all the pieces together and make them fit. The good news is we can't see anything too sinister on the scan at this stage. All right, Diggy dog, let's have a look down your throat. Okay, what do we see down here, Digger? There is... That's really interesting. I've got you, Diggy dog. I know what your problem is. Okay, yep, I can see what's happening there. I have got what looks like an old injury site. I reckon that's where he had the old abscess, down the left side of his throat here. It's all closed over and sealed up just with scar tissue. Yeah, he's certainly done some damage back there. The problem started when he had the abscess 10 months ago. And what I think is happening is he's got some scar tissue in the back of his throat that's actually interfering with the little valves that animals use when they swallow to stop food going down into their windpipe. And what's happening is that that little valve mechanism is a bit stuck, and I suspect that that's what's causing the problem in Digger's throat.
Further surgery would only cause more scar tissue and make Digger's problem worse. But Steve is hoping a few simple changes will prevent the problem from happening again.
What my suspicion is that we just need to change some of the things he does, like chewing sticks and bones, maybe put him onto some softer food which is easier to swallow, and just keep an eye on things to make sure he's not having more of a difficulty that we need to address in a more radical way with an operation or something similar.
Good boy. Can you sleepy still?
Hello, Digger. How are you, Diggy dog? Let's have a look at you. Come on, mate. Out you come. Come on. Whoa! You're feeling a bit better, mate, aren't you? Hey? How good is that? You leapt into my arms, didn't you? Hey, how's your throat going?
At SASH, after a few days' rest, Kelpie Digger is no longer struggling to breathe.
Looking pretty good, mate, aren't you? All that swelling's gone. You're swallowing all right. You had some breakfast, have you? What was the hospital food like, mate? Was it all right? I don't think Digger needs any surgery at the moment. It might be something that we need to do into the future, but at this stage his swelling's come down, his throat's comfortable, he's eating well, he seems to be breathing fine, which is obviously the most important thing, and I think he can go home. Oh, he's a good dog. Should we go home and see Mum? What do you reckon? I reckon.
It's been an anxious few days for devoted owner Ingrid.
Well, without having Digger around has been really tough. Yeah, it's a very quiet place without that crazy kid around.
Good boy, Digger.
Diggy!
Where's Mum?
Hello, Bubba!
There he is.
Hello, darling! Look at you! Hello, sweetheart! Oh.
That's excitement for you.
Oh, little man!
So, Ingrid, do you think he's happy to see you, or just quietly?
I think I'm happier than he is. Hello, Bubba. Hello, did he look after you? What's your neck, sweetheart? What's your neck? Hello. I'm so happy to have that little man back. It's just, yeah, it's beyond words. Thinking that he wasn't going to come home or he was going to be really sick for a long time was, yeah, a bit much to think about. He's a good boy. He's a good boy. You want to come home? Do you want to come home? Didn't want to get tears, but they were there. They were in the background. So yeah, he's our little man. He's just so much a part of our world. And to see him so happy, yeah, it was awesome. Can you shake hands? Sit down.
Sit down.
Shake hands.
Oh,
good boy. Say thank you.
It's been
Give him
a
a
pleasure.
kiss.
Digger was just so excited to see Ingrid, and you can see that they've got that really special bond, which is so lovely. And Digger's looking good. I think his throat looks a lot better, and I'm hopeful he can just go home and get on with his life.
Good boy. Wait till you see Daddy in red. Hey, good boy.